Well, in the coming days and weeks, you'll likely hear a lot of talk about prostate cancer as September kicks off its awareness month. And for all the men out there, it's important to not only know the signs and the risks, but what to do if you do need treatment. So for that today, we turn to Dr. Douglas Widman. He is the medical director at Columbus CyberKnife. So good to have you back, doctor.
Thank you for having me.
So September is an important month, obviously. What do you do really to help people kind of raise awareness about prostate cancer?
Well, I think what we're doing right here, try to talk about it, and I think the main thing is to raise awareness. That's the number one thing during the month of September. We're also trying to, always trying to generate interest in research to try to figure out how to better treat prostate cancer.
So when we talk about how common it is, and I think that's why awareness is so needed, is, there are a lot of people out there who don't know that they have it. So how common is it among men?
It is a very common problem, especially as men get older. It's actually the number one cancer in men. It's the number two cancer killer. So it's extremely common, unfortunately.
And unfortunately, as you say that, is that it does kill. And a lot of times I feel like we hear prostate cancer and think, oh, it's a lot of the watch and wait sometimes for that kind of thing. Is that changing? Is that it just depend on each case?
It's still controversial. We still promote screening, but there are prostate cancers that you can do what we call watch and wait with, or active surveillance, and it's another area of ongoing active research.
Yeah, absolutely. Okay, so what are some early signs and symptoms as people are out there and maybe have no idea that could be what's happening to them?
Most of the cancers that we deal with in radiation therapy are asymptomatic, and they're caught because men are having their PSA blood test done.
Okay.
They're going to screenings. So really, most men that we deal with don't have any symptoms from their prostate cancer. In more advanced stages of prostate cancer, it certainly can affect urination. Sometimes it can trigger blood in the urine.
Okay, so some things to watch out for sure. So let's now talk about the CyberKnife robotic radiosurgery system. Very high tech, obviously, way of treatment. So tell us exactly what it is.
It's a very nice way of being able to apply radiation therapy to prostate cancer. And the biggest advantage is you can deliver an entire course of treatment in just 5 treatments. Historically, you had to commit to about 8.5 to 9 weeks of daily treatment. So CyberKnife really has been revolutionary in that it gives patients a much more convenient way to go about doing radiation therapy.
And is that a benefit? I could imagine. I mean, there's a lot of emotional feelings that go along with anybody who's diagnosed with cancer. I imagine that also helps in that aspect, doesn't it?
Oh, yeah, absolutely. I don't think I've ever met a patient. It's kind of a silly question, but would you rather commit to doing 5 treatments or doing 8.5 to 9 weeks of treatment? Most guys that we're dealing with are still, regardless of their age, are very busy and have active lifestyles, and so it's
definitely a benefit for them. Something else you want people to embrace in this world especially is the need for second opinions. Why is that so important to you?
Yeah, I can't emphasize enough how important it is to get second opinions. There are lots of different options, and it's terribly confusing for, I would say, most patients, and they get lost in that, and it never hurts to get second and third opinions if necessary.
And CyberKnife, I do want to mention, it's a service of and located at Mount Carmel, right? So if somebody is interested in learning more, do they just go to the website to kind of get started, give you a call?
Yeah, they can call our department directly.
Okay.
We do have a website. So either way, we're very easy to get a hold of.
Absolutely. And just educate yourself. I mean, that is a part of the awareness campaign, of course, and knowing all of your options, including CyberKnife. So, doctor, thank you for being here to share that with us.
Well, thank you.